Hi, I'm Dr. Pooja Ghalla Gogri from Jyotirmay Eye Clinic, and today I'm going to take you through how to use your eye drops or how to instill them when you've been prescribed some. So, the first thing that I want you to confirm is to check the name, double check the name, that is the content, if it's a combination of the two drops, and what is the strength of the drop that has been prescribed to you. Once you've confirmed that your bottle is correct, remove your bottle and wash your hands and then uncap your bottle. Once you've uncapped it, keep the cap on a safe, clean and dry surface. Don't touch it or don't let it be in a dirty space. Remove this ring from the top. Then this cap has a little pin or a pointed edge inside the cap, which is going to help you to open the nozzle of your bottle. A new bottle will have no opening. Only once you're going to tightly close the bottle, it will puncture it through and open it. Make sure you don't use any dirty pin to puncture your drop. Thereafter, discard the first drop. In case your drop is a suspension kind of a drop, make sure that you're going to shake it well before you're going to use it. Also, if it is a clear bottle and you see that the drop looks discolored or it looks like it has any dirty precipitates, make sure you discard it and get a new one. We're now going to show you how to instill the drops. Before you instill the drops for someone, make sure you washed your hands and they are clean or you've sanitized them. Ask the patient to lie down flat on the floor, on the bed, or turn the neck behind. After that, make sure that you just retract the lower lid so that you have some space in the pocket that is created, and from a little distance away from the eye, without touching the nozzle to the eye, eyelashes or eyelid, we are putting single drop inside the eye. Ask the patient to close the eyes, aankh band kar lo, and put a little pressure next to the nose in this position to avoid this drop from going into the nasal duct or into the throat. If that happens, you're going to taste the drop in your throat. Once this is done, you can remove the punctal occlusion, keep the eyes closed for about 30 to 60 seconds, and then we're good to go. You can do the same for yourself even with the drop. Once you have finished instilling your first drop, what I would recommend is that you label the drop. Label the date on which you've opened the eye drop, because most of the drops are good to use once they are open for about 1 month. Now, where are you going to know how safe is it and how long can you keep your drop for use? If you can open the leaflet which is provided to you in the box, they're going to have some instructions about the storage and how long you can use the drop once the drop is open. Certain bottles have a different technology for preservative-free drops, and those can be used for longer period of time. However, most often drops need to be used within 1 month. Once you're done with 1 month of the use, please make sure you discard the drop. In case your nozzle is touching any eyelid or any eyelashes which are dirty or any other surface which is dirty, it can get infected and you can get infected as well. Please make sure that you check or read the instructions on the leaflet that is provided inside in case you're pregnant or you're lactating, to confirm that the drops are safe for you to use. In case you're using contact lenses, make sure that the drops are safe to be used. Otherwise, it's better to remove your contact lenses and use your drops thereafter. Sometimes you may be provided with some suspension drops, which are milky drops. Make sure that you shake the bottle well before use and then instill it so that you have adequate medication in every drop that you're going to be instilling. If you have been prescribed a drop twice in a day, make sure that you're dividing it equally 12 hours apart. After that, when you want to store the drop, store it in a cool place, a dry place. Certain drops may require refrigeration, and the temperature at which you need to store it would be probably given to you in your leaflet. These are some drops for glaucoma which require refrigeration. Remember, it does not require freezing, only simple refrigeration. When you need it, remove it, instill it and put it back inside to maintain the strength and the potency of the drop or the molecule. In case you've been prescribed antibiotic drops, please make sure that you're completing the entire course. Even if you're feeling better, do not stop the drops till the course is completed. And also remember, don't use over-the-counter drugs because often you may be given steroid drops which will have some side effects which you're going to land up with. In case you've been prescribed an eye ointment, what you've got to remember is very similarly, there is going to be a lock or a seal which you're going to open up. Once you open the seal, you're going to have to uncap it, and when you uncap it, you're going to have some ointment which is going to come out once you squeeze it at the back. Now if you see the ointment comes out quite thick, you want to use this again in the pocket of the eye and use only about this much, which is about 1/4 of an inch, to go into the eye. Once it is instilled, just remove it and then recap it in a clean and sterile manner. What you've got to remember is sometimes when you open your eyes, you're going to find it a little blurry after the ointment. So blink for a few times and then you're going to be good to see clearly. If you've been prescribed a drop and an ointment, you can use the drop first, followed by the ointment. So happy and safe instilling your medication, and make sure you finish your course.